For our normal balance, your little joint receptors in the feet and ankles have to feel where they're at in space, send those signals up to the spinal cord and then to the brain, where it gets interpreted to then come back down to keep you steady. So everybody can think of the drunk test where you're taking your finger and touching your nose with your eyes open and eyes closed. Well, that's because you have little receptors in your finger and elbow to know where my finger's at in space. So when I close my eyes, I can hit my nose once again. The balance in your feet works that same way. Those receptors of where that arch of your foot is, to know where my ankle, how it sits on top of it, can feel where I'm at in space. So if my foot starts to tip to the side, the receptors send those signals to the spinal cord and brain, and the brain responds by helping make the muscles contract to pull it back steady. When you have great balance, you feel you can step on that little rock and the foot turns back over where it should. When you have bad balance, the foot turns on the rock, but the muscles can't respond quick enough to pull you back, so we just end up falling. That's a great example of someone who had good control and keeps steady, and someone who has bad balance and control and just falls. And very commonly when you fall, you break stuff. So we're kind of against that. What we want to do is help find ways to help speed that neurologic learning to get your feet to stay steady and stay balanced. So we have a combination of sitting, standing activities to build that balance back up. We're going to get you on unstable surfaces such as foam, wobble boards, vibration plates, finding ways to knock you off balance and make the muscles pull themselves back over. A lot of it is just learning and re-education. That's why it's called neurologic re-education for balance, is we want to find ways to make you get more efficient so that you stay steady and don't fall.